Good afternoon. It's Saturday, March 14th at 12:07 p.m. I'm Dr. Adam London from the Kent County Health Department, and I just stepped out of our COVID-19 Emergency Operations Center here, and I want to give you a brief update, keeping in mind that this is still a very fluid situation. Things are changing in rapid fashion, and we're going to continue to give these updates as situation develops. First of all, I want to express my sincere gratitude and appreciation for the overwhelming positive response that we've all received and that we've all seen in the community over the past couple of days. Events have been canceled, people have changed their way of life, people have done an amazing amount of preparation for what we're told is going to be a serious challenge to the health of our community. And I know these things have been difficult, and I know that it also brings with it all kinds of other concerns and fears that we're all trying to be prepared for. But I just want to express our gratitude and our recognition that while these things are difficult, these decisions have been challenging, they are in the best interest of public safety and public health, and we hope and expect that it makes a significant difference in how our community is affected by COVID-19. So last night we learned that an additional 9 positive cases of COVID-19 were identified by the state laboratory. All 9 of those were in lower peninsula counties. 7 of them were from southeast Michigan locations. 0 were from Kent County or surrounding counties here in West Michigan. So yesterday, 6 of our tests that Kent County sent in came back to us as negative for COVID-19, which means we've had a total of 20 negative tests received back from the state lab, 3 positive tests, and we're still waiting for 39 tests that we have pending with the state lab at this time. However, keep in mind that tests are continuing to be submitted to the state lab on an ongoing basis. I also want to remind everyone to please do what we can to alleviate the burden that our first responders and our emergency room physicians and our doctors' offices are feeling right now. They have been truly overwhelmed in the past couple of days with people stopping by with minor respiratory symptoms. So we want to be careful that we're protecting the health of those healthcare workers and also being good stewards of the very limited testing supplies that we have. So the advice that we're giving is that unless you are severely ill, you should call your doctor's office, you should call the emergency room before showing up at their office for care. Many of them also have an online presence with telehealth or other virtual presence that you can engage in order to get screening and determine if you should be tested for COVID-19. But please, let's be thoughtful of how do we best protect our healthcare workers in this very vulnerable and important moment. We've also had lots of inquiries from the community about how people can help. Practical things. People are looking for practical, pragmatic things they can do in this moment to help their neighbor and to help their community. I want to give you a suggestion today, and we're going to continue to give you suggestions as this situation develops. But today I want to encourage you to think about those in the community that could really use some help with food and nutrition. So while many of us have been stocking up on food and preparing for the possibility of quarantine or the possibility of being away from the store for a few days, up to a few weeks or perhaps longer, there are many in our community that just don't have the financial ability to do that sort of preparation with food and other supplies. So I want to encourage you today to go to kidsfoodbasket.org. They're doing tremendous work in the community, making sure that our most vulnerable families are receiving the food and the nutrition that they need. They're looking for donations, and especially donations of cash. The money that we can send to kidsfoodbasket.org is really going to help them to make sure that they have the supplies they need in a timely manner to help those families. In addition to going to their website, you can also text KFB to the number 56651. Again, I'm Dr. Adam London for the Kent County Health Department. We're going to continue to provide these updates. Please like and share this Facebook page, and I look forward to talking to you very soon. Thank you.